Hello everyone, it's Dr. Ashley. Today and going forward, I'm going to start a series where I'm just going to go through and answer everyone's questions. I know I've been out of the community for a few months, but for now, I'm going to go ahead and answer your comments, your questions. I'm just going to start going through everything and give you guys the answers you've been asking for. So in this particular video, I'm going to answer a question from a user saying or asking, what do you think are good jobs to start off in the business of healthcare? Could you give some examples, please? I'm starting my bachelor's program soon and I want to get on top of things. So it sounds like this person is just barely starting the bachelor's degree, right? Which means you're going to have at least 4 years of school before you really get into a point where you probably want to start a career. And I don't know if you plan to do your master's degree afterwards. Not necessary, but I will say, let's just dive into this question, right? Given that you are just beginning your bachelor's degree, I would say that, let me be completely honest with you, you do not necessarily, I would not go straight into just starting any old job in healthcare. That might sound crazy to a lot of you, but the reason for that is because you are just starting to open yourself up to this very, very broad spectrum of all different types of opportunities, different areas of healthcare. Healthcare administration, it's the business of healthcare. You are learning about healthcare as a business, the business end, and it is vast. There are so many different areas of healthcare that you can work. So if you need money as a student and you figure you should start working in healthcare, I understand that. And so at the end of this video, I'm going to give you some ideas, some job ideas that you can go. Sorry, my camera wasn't. Here it is. We're back. So at the end of this video, stay tuned because I'm going to actually give you a list of ideas that you can go try to either apply to right now, some entry-level healthcare job ideas, and also some that will require some certification, but it's not going to take very long, and the certification problems should be pretty quick and cheap. And that will help you start a job in healthcare that you can work in as a student while you are progressing through your degree. But what I will say right now is please start thinking about where you want to go in healthcare, which direction you want to take this throughout your entire educational career. You need to start really learning about what your interests are in healthcare. Where do you think that you want to interface with patients, or no? Are you more of someone who wants to work with data? Do you want to work more in public health? Do you want to work in marketing? Do you like pharmaceuticals? Do you think that you might also enjoy medical records? Do you think you might enjoy managing a small clinic? There's so many different ways you can take your healthcare administration degree. So you need to start thinking about that now, and therefore you can start exploring while you're going through your degree. You can start looking at different companies. You can reach out to different businesses locally and let them know your interest and see if they have any volunteer programs, internship programs, or mentorships. Sometimes they'll even just let you shadow, and that way you can get a good idea of what types of jobs are available in that space, what it might be like to work in that space, because sometimes you're going to see what's going on over in that work environment and you might not like it. You might think this is definitely not for me. I do not want to sit at a computer all day long. I wanted to do something more like this. So it is a good idea to start exploring, figuring out exactly where you want to go in healthcare, and then start working on making those connections now. Now is the perfect time to do it. So you're young, you're just starting your degree program, and it's going to be about 4 years. 4 years is perfect. Slowly get to know the vast of healthcare administration, start getting in touch with different interests you have in healthcare, then possibly start working on getting your foot in a volunteer program or an internship, something like that. And while you're doing that, make sure you network. Make sure you talk to people who are there, talk to them about their job, talk to them about how they even got there. And if this is something that you really like, I guarantee you by the end of your degree, it's going to be really easy for you to get the job that you actually want because you have help, you have people who know how to get there. You've already been working or volunteering, helping out in a facility and some business within the space that you want. People, you have the knowledge, like I said. And when opportunities show up and they know your name when you start applying, they're calling you. So that would be the best thing I can say in terms of how you should go about finding a job in healthcare now, since you're just starting your education. That being said, if you need money now and you want to work in healthcare, here are some ideas that you should start applying to for now. And also look in, because some of these are going to require certifications. So go ahead and look for certification programs that are fast, cheap, and just do it and try to get these jobs. Shouldn't be too hard. So let me go ahead and give you that list real quick. I jotted a few down. Let me find them for you. So give me a second. All right, so in terms of patient interfacing type jobs, right? You can go for a medical receptionist. You can go for a patient care technician. You can be more of a medical transcriptionist, which is, in a way, sometimes it's interfacing with patients. Sometimes that particular one is not going to be interfacing with patients. You're just going to be interfacing with medical professionals. So that one's hybrid depending on where you work. Also, you can do a CNA, which is a certified nursing assistant. So these are all just every single one that I mentioned here that are more patient interfacing roles. These do require certifications. The certification program, not too long, shouldn't be too expensive, but do your research and figure out what might be the best for you if you want to interface with patients, if that's something that you think you want to go ahead and do. If you're doing medical or healthcare administration, and more likely as a healthcare administrator, you're probably not going to be interfacing with patients too much, depending on where you work, but you may want to look at more administrative roles. So some administrative roles you can look into and possibly check out certification programs that you can work through would be medical billing, medical coding, right, and which is pretty much the same thing. Again, medical transcription is a good one. Medical transcription is basically where you're going to be working with medical professionals like physicians and nurses and whatnot, and you're going to type what they tell you to type in the medical record. That's the basic gist of it. Because many times doctors they'll be transcribing or they'll be recording their notes for their patients, right? They don't usually just do it themselves. So they will be recording that, and then your job would be to listen to the recording and go ahead and create the physician notes or for whatever care provider. So that is a good role to do. That's a very good job. Also, you can look into being a data entry clerk. That's usually going to fall under medical records or healthcare records. And usually those do require certifications as well, especially because of HIPAA regulations and all of that. And then there is also a health unit coordinator that it's gonna be more of an assistant type of role, coordinator, assistant. But yeah, you would need a certification for that or a little bit of experience. So those are some that you can look into. Almost everything that I mentioned is going to require some sort of certification. You can't just jump into it. But all of these certification programs are usually inexpensive and fast. It would be more of a 6-month certification program, and then you finish, you have your certification, you can start applying for jobs and whatnot. So as a student, that would be smart to do if you do need to jump into the job market and start working for money right now. That would be a good idea. Other than that, like I said, research what you want to do long term. The only reason why I don't think that you should just jump into a job within healthcare right now is because that might not be something that is going to be conducive to helping you get into the career that you want long term. Or maybe it is. Maybe you do have a lot of interest in one of the things that I mentioned, and then that would be perfect for you. So it's really up to you. But I would be trying to think long term before anything else, because you are just a student right now. So if anything, if you do need money, there's always fast food, Walmart as well. For now, long term, I would say is the most important focus for you. I hope that helps.